Most people over 60 have been handed the same quiet assumption by the medical system. High blood pressure is a lifelong condition you manage, not one you influence. You take the pill. You monitor the numbers. You hope for stability. What nobody mentions, not at the pharmacy counter, not in the 15-minute appointment, is that your body already contains a pressure regulation system far older than any drug on the market. It runs through your nervous system. It responds in seconds, and it costs absolutely nothing to activate. I'm Dr. Alex Thompson. I've spent 2 decades in cardiac surgery, and what that time taught me isn't just how to repair a damaged cardiovascular system. It's how profoundly that system listens to stress, to stillness, to the rhythm of your own breath. Here's the truth most patients never hear. Your nervous system has 2 modes. One raises pressure, one lowers it. After 60, most people are locked into the first one, not by disease, but by decades of accumulated tension that nobody ever showed them how to release. Breathing exercises don't generate revenue. There's no patent on a slow exhale. No insurance code for teaching someone to use what they were born with. That's largely why this conversation rarely happens in a clinical setting. But the physiology is real. The research is published. And the results, when people actually commit to the practice, are measurable in ways that show up on the monitor, not just in how you feel. What I'm going to show you today isn't a substitute for your medication. It's something your medication cannot do: teach your nervous system how to stand down. After 60, that knowledge isn't optional. It's essential. Medical school gives you the science. 2 decades in a cardiac operating room gives you something harder to teach: the ability to explain what's actually happening inside a human body in language that means something to the person sitting across from you. So let me give you the honest version. No jargon, no textbook. Your arteries are not plumbing. They're not copper pipes running behind a wall, fixed and passive. They're living, breathing tissue layered with muscle, lined with cells, designed to flex and respond with every single heartbeat. When you're younger, they do this with ease. They expand when pressure rises, recoil when it falls, and regulate the flow with remarkable precision. But decades change that equation. Arterial walls gradually thicken. The smooth muscle stiffens. The elasticity that once made them so responsive begins to diminish. Your heart, sensing greater resistance, compensates by pushing harder. That extra effort registers as elevated numbers on the blood pressure cuff. That's the structural story. Most people understand it reasonably well. What almost nobody explains is the second story, the one happening in your nervous system simultaneously, and in many ways driving the first. Your autonomic nervous system operates entirely beneath your conscious awareness. It governs your heart rate, the tension held in your blood vessel walls, and the hormonal signals coursing through your body at any given moment. It runs on 2 opposing systems. The sympathetic system is activation, urgency. It constricts blood vessels, accelerates the heart, and floods the body with cortisol and adrenaline. It evolved to save your life in moments of genuine danger. The parasympathetic system is recovery. It dilates vessels, slows the heart, and allows pressure to fall. It's the biological equivalent of setting down a weight you didn't realize you were still carrying. Here's what 2 decades of cardiac surgery made unmistakably clear to me. After 60, the balance between these 2 systems shifts. Life accumulates. Stress compounds. Sleep becomes lighter. And the sympathetic system, that state of low-grade alertness, becomes the default. Not because something is broken, because nobody ever showed you how to activate the other side. That's not a problem medication solves. A blood pressure drug addresses the pressure itself. What it cannot do is retrain a nervous system that has forgotten how to downshift. That's precisely what controlled breathing does. Every slow, deliberate exhale, longer than your inhale, unhurried and complete, sends a direct electrochemical signal through the vagus nerve directly to your brainstem. The message it carries is specific. Stand down. In response, blood vessel walls release their tension. Resistance drops. The heart eases its effort. All of it measurable. None of it metaphor. 3 techniques. 3 different mechanisms. Together, they give you something no prescription ever has: genuine, reliable access to your own body's pressure release system. Let me tell you about a patient I'll call Raymond, 71 years old, retired high school principal, the kind of man who spent 4 decades being responsible for everyone else and had very little practice letting anyone take care of him. He came to me carrying two things: a blood pressure reading that wouldn't cooperate, and the quiet exhaustion of someone who had been managing a problem without actually solving it. He was already on medication, had been for 3 years. But his evening numbers kept climbing, sitting in the high 150s when they should have been winding down toward rest. This pattern, by the way, is one of the most common and most under-addressed issues I see in patients over 60. Evening court, and the pressure stays elevated precisely when the cardiovascular system most needs to recover. His daughter had bought him a home monitor. She checked it every night after dinner. Thoughtful gesture. But Raymond told me the moment she picked it up, his chest tightened, anticipatory anxiety driving the very numbers they were trying to lower. A cycle I've seen more times than I can count. I introduced him to the 4-7-8 method. He listened the way intelligent, skeptical people listen, attentively, politely, and with considerable doubt behind the eyes. That's fine. I don't need belief. I need compliance for 3 weeks. He gave me that. When he returned, his evening systolic readings had dropped an average of 11 points. He was falling asleep faster. His daughter had put the monitor in a drawer. The numbers, she told him, were boring now. That's exactly what we want. Here is the technique. Precisely as I taught it to him. Sit with your back supported and both feet flat on the floor. Let your hands rest open on your thighs. Close your mouth and inhale slowly through your nose for a count of 4, smooth, controlled. No urgency. Simply fill the lungs evenly, then hold for 7 counts. This is where most people hesitate, but the physiology matters here. A brief breath hold allows carbon dioxide to accumulate slightly in the bloodstream, which signals the blood vessels to soften and dilate. Then exhale through slightly parted lips for 8 full counts. Unhurried, like you're breathing across the surface of still water without disturbing it. That is 1 cycle. Repeat it 4 times, consecutively. The entire practice takes 90 seconds. You can do it before your feet touch the floor in the morning, in your chair after dinner, in a parked car before a doctor's appointment, which, for many of my patients, is precisely when their pressure spikes highest. Twice daily produces measurable results within 2 weeks. 4 times daily accelerates them. 1 caution. If lightheadedness occurs during the hold, reduce it to 5 counts. The goal is regulation, not strain. Your body will adapt faster than you expect. Of the 3 techniques I'm going to share with you today, this one holds a particular place for me. Not because it's the most dramatic, it isn't, but because after 20 years of watching hearts up close, understanding what makes them age well versus age poorly, this practice targets something most cardiovascular interventions completely ignore. It's called resonance breathing. Some researchers refer to it as coherence breathing. The name matters less than the mechanism. Here's what's actually happening inside your chest with every heartbeat. Your heart rate isn't constant, nor should it be. It rises slightly as you inhale and drops slightly as you exhale. That subtle fluctuation, invisible to you but measurable on any cardiac monitor, is called heart rate variability, and it tells cardiologists something profound about the biological age of your cardiovascular system. High heart rate variability means your heart is responsive, adaptive, resilient. It's the signature of a system that still knows how to flex. Low variability, a heart beating with rigid, metronomic regularity, is associated with elevated blood pressure, increased cardiac risk, and accelerated biological aging at the cellular level. The remarkable discovery, replicated across dozens of peer-reviewed studies, is this. When you breathe at precisely 6 breath cycles per minute, a 5-second inhale followed by a 5-second exhale, heart rate variability reaches its physiological peak. Your cardiovascular and respiratory systems fall into a rare synchrony that researchers call resonance frequency. In that synchronized state, blood pressure drops, cortisol decreases, and the parasympathetic nervous system assumes full control. 6 breaths per minute is the target. For context, most adults breathe between 12 and 18 times per minute without awareness. So 6 will feel almost startlingly slow the first time you attempt it, almost like you're not getting enough air. That sensation is temporary and entirely normal. Within 3 or 4 sessions, your body recalibrates and the pace begins to feel natural, even deeply satisfying. The practice itself is uncomplicated. Find a comfortable seated or reclined position. Inhale through your nose for 5 full seconds, not a deep forced breath, simply a slow and even one. Then exhale through your nose or mouth for 5 seconds at the same unhurried pace. No holding, no pausing. Just one continuous, unbroken wave of breath moving in and then out. 5 seconds in, 5 seconds out. Repeat for 5 to 10 minutes. Twice daily. Where you do it is entirely your business. A chair by the window. The back porch before the neighborhood wakes up. The couch during the quiet hour after dinner. Context is irrelevant. Consistency is everything. After 2 weeks of daily practice, most people measure a resting systolic reduction of 5 to 8 points. That number may sound modest, but sustained across months, it compounds into genuine, clinically meaningful cardiovascular protection. Consider this. In an ordinary day filled with obligations and noise and demands, when do you ever allow yourself 5 uninterrupted seconds just to exhale? For most people, the honest answer is never. And their hearts have been waiting for that signal their entire lives. I'll be straightforward with you. Of the 3 techniques, this is the one that earns the most skeptical looks in my office. And I understand why. When I first introduced it to a patient, I'll call Frank 74 years old, retired federal judge, a man who had spent his entire career demanding evidence before accepting anything, he set down his glasses, looked at me with the particular patience of someone who has heard a great deal of nonsense over a long life and said, "Doctor, are you seriously suggesting I sit here and plug my nose?" I told him I was, and I told him why. This practice originates from yogic tradition, refined over thousands of years of disciplined observation of the human body. I recognize that provenance can make it sound like something discovered in a lifestyle magazine between smoothie recipes and crystal recommendations. Set that association aside, because the physiological mechanism underneath this technique has been studied rigorously, documented in peer-reviewed research, and is entirely consistent with what modern neuroscience understands about autonomic nervous system regulation. Here is what's actually happening anatomically. Your left and right nostrils are not interchangeable passages. They connect through separate neural pathways to opposing branches of your autonomic nervous system. Left nostril breathing preferentially activates the parasympathetic system, the recovery state that widens blood vessels and lowers pressure. Right nostril breathing engages the sympathetic system, the activation state that tightens vessels and raises pressure. Alternating deliberately between them drives your autonomic nervous system toward equilibrium. And in that balanced state, vascular resistance drops, cortisol recedes, and blood pressure follows. Published research has documented systolic reductions of up to 10 points within 4 minutes of practice. For context, that response time outpaces the peak effect of most fast-acting antihypertensive medications. This makes alternate nostril breathing uniquely valuable not just as a daily discipline, but as an immediate intervention when difficult news arrives without warning, when anxiety begins climbing, when the pressure inside and outside your body rises simultaneously. Here is the technique exactly. Sit upright with your left hand resting open on your left knee. Raise your right hand to your face. Close your right nostril gently with your right thumb. Inhale slowly through your left nostril for 4 counts. Then press your right ring finger over your left nostril. Release your thumb and exhale through your right nostril for 4 counts. Inhale again through the right for 4 counts. Close the right with your thumb. Open the left and exhale through the left for 4 counts. That completes 1 full cycle. Perform 6 to 8 cycles. The entire practice requires 3 to 4 minutes. The first few sessions feel mechanical. Your hand position is unfamiliar. Your rhythm hesitates. That passes quickly, usually by the 3rd or 4th attempt. The body takes over and the mechanics disappear. As for Frank, the retired judge who required evidence before believing anything, he practiced every morning for 5 months. At his next cardiology appointment, his physician initiated a conversation about carefully reducing one of his medications. I'm not attributing that entirely to breathing, but something in his picture had measurably changed, and he knew exactly what was different. There's a piece of advice I give every patient before they leave my office with these techniques. It's the same regardless of age, history, or how motivated they feel in the moment. Don't trust how you feel. Measure what's actually happening. This isn't cynicism. It's precision. Human perception is a genuinely unreliable instrument when it comes to cardiovascular health. People feel fine the morning of a cardiac event. People feel terrible when their numbers are perfectly controlled. Subjective experience and biological reality frequently disagree, and in that disagreement, the numbers win every time. So here's the protocol I recommend alongside the breathing practice itself. If you don't own a home blood pressure monitor, purchase one. They are inexpensive, widely available, and one of the most consequential investments a person over 60 can make in their own health intelligence. You cannot manage what you cannot measure. Begin each session the same way. Sit quietly, not scrolling, not talking, not processing the morning news for 5 full minutes. Then take a reading and record it. Not in your memory, on paper or in a notes application, somewhere retrievable. Then complete your breathing practice. Afterward, sit quietly for 2 minutes and take a second reading. Record that as well. Do this every single day for 2 weeks. Not most days, every day. The data you're building has no value if it has gaps. What you'll likely observe immediately is a drop of 5 to 10 systolic points following a single session. That's real, and it matters. But that's not the number I want you watching most closely. The number that tells the true story is your morning baseline taken before coffee, before conversation, before you've given your nervous system anything to react to. That reading, tracked consistently at the same time each day, is the clearest window into what these practices are doing at the physiological level over time. This timing consistency is not optional detail. Blood pressure moves naturally throughout the day, typically lower in the early morning, climbing through the afternoon, varying with meals, stress, and activity. Comparing a pre-breakfast reading to a post-dinner reading produces noise, not information. Same time daily produces data you can actually use. Watch your morning baseline across 14 days. For most people who practice consistently, that number begins moving in the right direction within the first week. By the end of 2 weeks, the shift is typically clear enough to be undeniable. And here is what I need you to understand about a 5-point sustained reduction in systolic pressure, because patients frequently dismiss it as modest. It isn't. 5 points maintained consistently over months translates into meaningfully reduced risk of stroke, cardiac event, and arterial damage. The research on this is unambiguous. This is not a small outcome made to sound large. This is a large outcome that simply arrives quietly, one measured morning at a time. That's how the most important changes in your body almost always work. I've been practicing medicine long enough to recognize the question forming in your mind right now. You've been listening carefully. You find the logic reasonable. But somewhere underneath the reasonableness is a very fair and very important challenge. Dr. Thompson, is any of this actually proven? It's the right question. It's the question I'd ask. And it deserves a direct, specific answer, not reassurance, not enthusiasm, not the kind of vague confidence that substitutes for evidence. Actual data. Let me give it to you. A study published in the journal Hypertension, one of the most rigorously peer-reviewed cardiovascular publications in medicine, examined the effects of slow, controlled breathing practices on blood pressure in hypertensive adults. The finding: an average reduction of 8.6 points systolic over 8 weeks of consistent practice. To put that number in clinical context, that result is comparable to the pressure-lowering effect of several first-line antihypertensive medications currently prescribed as standard of care. Not fringe medicine, not alternative wellness. A result sitting comfortably within the range of pharmaceutical intervention achieved through breath alone. The Indian Journal of Physiology and Pharmacology published dedicated research on alternate nostril breathing specifically. Participants practicing the technique regularly showed systolic reductions exceeding 10 points after a 4-week period. That is not a subtle signal buried in noise. That is a clinically meaningful number, the kind that prompts physicians to reassess medication dosages. Then there is a landmark review published in Frontiers in Human Neuroscience, a comprehensive analysis examining more than 50 independent studies on controlled breathing and cardiovascular function across diverse patient populations. The conclusion drawn from that body of evidence was consistent and unambiguous. Slow, deliberate breathing reliably activates the parasympathetic nervous system, measurably reduces circulating cortisol, demonstrably lowers vascular resistance, and produces sustained, reproducible reductions in blood pressure over time. 50 studies, different researchers, different institutions, different patient populations, the same direction of effect. Now, and I want to address this directly because intellectual honesty requires it. Is there a placebo component woven into any behavioral health intervention? Possibly. That is a legitimate scientific consideration, and I won't dismiss it. But here is precisely why it doesn't undermine what I've just described. The physiological markers researchers measured in these studies are not self-reported. They are not subjective. Heart rate variability is measured on equipment. Blood vessel dilation is quantified through flow-mediated dilation testing. Cortisol levels are drawn from blood and saliva samples processed in laboratories. Vascular resistance is calculated, not felt. You cannot convince your vagus nerve to release acetylcholine through the power of positive thinking. You cannot placebo your parasympathetic nervous system into dilating your blood vessels. These are electrochemical events. They follow the laws of biochemistry, not the laws of expectation. When the instruments show the change is real regardless of what the patient believed going in. Frank, the skeptical federal judge I mentioned earlier, did not believe this would work. He said so plainly. He practiced anyway, because the mechanism made physiological sense to him even if the outcome seemed improbable. His cardiovascular markers shifted. His physician noticed. His medication was reconsidered. Belief was not a variable in that outcome. Biology was. I also want to be unambiguous about something that matters enormously, because responsible medicine demands clarity here. These techniques do not replace medication. For the overwhelming majority of people managing hypertension after 60, pharmaceutical intervention remains appropriate, often essential, and should not be discontinued, adjusted, or second-guessed without direct guidance from your physician. I am not standing here as someone who believes breathing supersedes cardiology. I am a cardiac surgeon. I have seen what uncontrolled hypertension does to a heart muscle, an arterial wall, a kidney, a brain. I take this disease seriously. What I am telling you with equal seriousness, grounded in the same published evidence, is that controlled breathing practices accomplish something your medication fundamentally cannot. Medication manages the pressure. It does not retrain the nervous system generating it. It does not restore heart rate variability. It does not teach your autonomic system how to shift out of chronic sympathetic activation. It addresses the downstream consequence without touching the upstream driver. These techniques address the driver. Used together, medication and breath-based practice, they cover ground that neither covers alone. That integration is not compromise. It is comprehensive care. It is what the evidence actually supports. And after 20 years of watching hearts fail in ways that might have been prevented, it is what I wish more physicians had time to sit down and explain. The research exists. The mechanism is established. The practice is yours to begin. Here is where most health advice quietly fails the people it's trying to help. It tells you what to do. It hands you a protocol, wishes you well, and leaves you entirely alone with the hardest part, which is never the information. It's the integration. It's finding where something new actually fits inside. A life that is already full, already structured, already running on its own momentum. After 60, your days have architecture, routines built over decades, a rhythm that works, more or less, and doesn't welcome disruption gracefully. I'm not going to ask you to disrupt it. What I'm going to give you instead is a framework designed around the life you already have. Morning before your feet touch the floor. 2 minutes of resonance breathing. 5 seconds in, 5 seconds out. You're already lying there. Most of us spend those first minutes in a half-aware state, doing nothing in particular. Redirect 2 of those minutes. Your nervous system receives its first signal of the day before the world has had a chance to send one of its own. Afternoon or early evening, in whatever chair you naturally settle into. 4 cycles of the 4, 7, 8. 90 seconds. No props required. No silence required. No preparation of any kind. Just the breath. 4 cycles through, and you've given your cardiovascular system a deliberate reset at the moment of the day when cortisol tends to climb and pressure follows, and when difficulty arrives, because it will. That's when alternate nostril breathing earns its place in your toolkit, not as a daily ritual, but as an immediate response. 4 minutes between you and a pressure spike, between you and the anxiety that arrives without an invitation, between you and whatever the day has decided to send your direction. 3 techniques, 3 natural moments. Nothing in this practice exceeds 10 minutes of your day in total. The variable that determines whether this changes anything for you is not which technique you prefer. It is not the precision of your timing or the perfection of your form. It is whether you show up for 14 consecutive days. That is the threshold. After 2 weeks, the practice stops feeling like something you're remembering to do and begins feeling like something you simply do. After a month, patients tell me they notice its absence on the days they skip it. that noticing that small sense of something missing is the clearest sign the nervous system has genuinely recalibrated. I want to leave you with something I don't say lightly. I have spent 20 years in operating rooms doing work that most people never see and never need to understand in detail. I have held a living human heart in my hands. I have repaired arterial walls damaged by decades of unmanaged pressure, the scarring, the rigidity, the irreversible evidence of a system that never got the signal to stand down. And after all of it, every procedure, every recovery, every conversation in the difficult hours after surgery, the most consequential thing I can offer many of my patients is not technical. It's this: the understanding that their body is not broken. It has not given up. It has simply been waiting, for years sometimes, for the right signal. Your parasympathetic nervous system exists for precisely this purpose. It is not a relic. It is not weakened beyond use. It is available to you right now, today, with nothing more than your breath as the key. I had a patient 67 years old, a retired librarian who came to me certain that managed decline was simply what the rest of her life looked like. She breathes every morning now. Last week her reading was 114/72. She didn't change her medication. She changed her signal. That is available to you too. Starting today, before you close this out, I want to make sure what you've learned today doesn't dissolve into a vague intention. So let me bring it together cleanly, precisely, in a form you can actually use starting right now. 3 techniques, 3 distinct roles in your cardiovascular health. The 4-7-8 method is your daily anchor. 4 counts in through the nose, 7 counts held, 8 counts out through the mouth. 4 cycles, 90 seconds. Practice it at minimum twice daily, once before the morning begins and once before the evening settles. Think of it as punctuation for your nervous system. A deliberate pause that tells your body which gear it should be running in. Resonance breathing is your long-term investment. 5 seconds in, 5 seconds out. Sustained for 5 to 10 minutes, twice a day. No holding, no pausing, just one unbroken, rhythmic wave. This is the practice that recalibrates your baseline over weeks and months. Slower to show its work, but deeper in its reach. Alternate nostril breathing is your intervention tool. 4 counts left, 4 counts right, 6 to 8 complete cycles. Deploy it when pressure spikes, when anxiety rises, when the day delivers something your nervous system wasn't prepared for. 4 minutes. Immediate, measurable effect. That is the complete practice. 3 techniques, 10 minutes total across an entire day. Now here is what I want you to do before this video ends. If you have a blood pressure monitor within reach, go get it. Sit quietly for 2 minutes. Take a reading and write the number down, not in your memory, on paper. Then perform 4 cycles of the 4-7-8. Slowly, deliberately, exactly as described. Sit quietly for another 2 minutes. Take a second reading. Look at the difference between those 2 numbers. That difference belongs to you. It was always yours. You simply needed to know how to access it. If today's conversation was useful, I'd ask one thing. Share it with someone who needs it. A spouse, a sibling, a friend navigating the same territory after 60. The information costs nothing to pass forward. And for the right person at the right moment, it can change the entire trajectory of how they manage their health. I'm Dr. Alex Thompson, and I read every comment left below. Tell me which technique you're beginning with. Tell me what your numbers show. That conversation matters to me. One final note, and I mean this with complete sincerity. Everything shared in this video represents general medical information drawn from published research and 2 decades of clinical experience. It is not a substitute for the relationship you have with your own physician. Your history, your medications, your full clinical picture, only your doctor holds all of that. Please speak with them before adjusting anything. That heart of yours has been working without a single day off for every year of your life. Treat it with the same dedication it has shown you. It has carried you a long way. With the right care, it will carry you further still.